Alright, good morning Queensland and good morning Brisbane, and a big warm welcome to all of our Facebook Live followers as well. In some news today, we have 10,212 new cases. That includes 3,615 rats. Tragically though, it's my sad duty to report that 13 people have lost their lives, and once again we express our condolences to the families. And the Chief Health Officer will have more details about the age brackets, but they're all over their 70s. And he'll also have information about the numbers in hospital and the numbers in ICU. We've had 19,926 tests in the last 24 hours. 91.81% of eligible Queenslanders have had at least one dose, and 89.16% are now double vaccinated, but we expect those figures to come up a bit this afternoon. In good news, our 5 to 11-year-olds, 25.72% are now vaccinated. That's 123,119. We've got about 50,000 booked in. And now, if I can just stress to the families, we have 2 weeks now for your child to get vaccinated before school returns. And if you haven't got your child vaccinated, please come down here to the Brisbane Convention Centre. There's availability right now as we speak. And of course today is booster day, so the 3-month eligibility is starting from today. So please, if you are eligible, walk-ins are accepted for boosters. So that's good news. So the Chief Health Officer will talk about some of our figures, but of course we said to Queenslanders that we expect that these next 2 weeks are very critical in terms of reaching that peak of the Omicron wave. Of course, the Gold Coast has seen higher figures than Brisbane and the regions, but we expect that there'll be that Brisbane will essentially be reaching its peak over the next couple of weeks, and of course some parts of regional Queensland as well. But all of that information is being processed every day. And once again, my message is to the vulnerable members in our community, those elderly senior residents, about minimising your movements. And as I said, perfectly okay to go and do your shopping, perfectly okay to go and visit your family, but please avoid mixing in crowds just over the next couple of weeks till we get through this peak and we can get through all of this together. So of course, it's the 3 months since you've had your second dose. You can go and get your booster. It's important that you have that booster as an added level of protection. It doesn't take much time at all. You'll also hear from the Deputy Commissioner today about where you can get your vaccines on Australia Day. So please make it a family event, and please get vaccinated as quickly as possible. I'll hand over to the Chief Health Officer.
Thank you very much, Premier. Sadly, we have 13 deaths to report today, 4 in their 70s, 7 in their 80s, and 2 people in their 90s. 3 were unvaccinated, 1 had had 1 dose, and 9 had had 2 doses of vaccine. None had received a booster. Our thoughts are very much with their family and friends. With regard to the hospital situation, we now have a total of 878 people in public hospitals being treated for COVID-19 in Queensland. That's up very slightly from yesterday, when we had 863. Of note, the Gold Coast numbers in hospital have declined slightly every day for the past 4 days. So it would appear that the Gold Coast is close to or past the peak, the current peak. So it appears that the Gold Coast is close to or past the peak of transmission. In terms of intensive care patients, there are 50 people in intensive care in Queensland Health hospitals across the state. That's up slightly from 47 yesterday. And of particular note, I would draw your attention to the fact that of the 50 people in intensive care today, no less than 40% of them are unvaccinated. 40% of those people in Queensland intensive care units today are unvaccinated. Also, some important data, the number of hospital staff across the state in isolation or quarantine has declined steadily, slowly but steadily for the past 5 days. And I heard from the Police Commissioner a similar figure for police officers. The numbers are small, it's just slightly off the peak, but certainly not rising anymore. So, as we've said before, the Gold Coast was always likely to be the first area to peak. Brisbane should follow within 7 days, according to our calculations, possibly Cairns as well, and then other regional areas as well. I would remind everybody, though, that this is the peak, it's not the end. That means that we've got very significant transmission in the community at the moment, and the end will not be for a number of weeks. The peak it's early, but the number of people in hospital appears to be significantly lower than we had expected at this stage. This, we believe, has to do with people's changing behaviour in avoiding getting infected. So I certainly thank the people of Queensland in heeding the warning. So it does appear at this stage that the number of hospitalisations is lower than we expected. I guess we won't know for another week or so when we hit the general peak for Queensland, and particularly for the southeast Queensland, exactly how high that peak of hospitalisations would be. But we were certainly anticipating several thousand people in hospital. We've got, as I said, 878 people in Queensland hospitals, Queensland public hospitals at the moment. We're collating the information about private hospitals. We do know there are a number of people in Queensland private hospitals. We'll have that later in the week, because we need to collate that from multiple smaller hospitals around the state. But again, just to remind everybody, the peak does not mean the end. That means the high point. The other thing I should draw everyone's attention to is that schools will be recommencing in 2 weeks' time, and it's likely that when that occurs, there will be a further, probably, extension of the peak. So it may well be that we have a longer, flatter period because of schools, which is really what is ideal. Because the whole purpose of a lot of our measures has been to reduce the impact on the hospital and hospitals of Queensland, and at this stage Queensland hospitals are bearing up. But we'll see in the next 7 days, particularly as metropolitan Brisbane peaks, just exactly what happens there. So far, the impact of the epidemic is less than we expected so far in this wave, but it's still. I'm trying to be cautious here because we still haven't reached the peak here in Brisbane. Okay, thank you very much.
Thank you, Premier. So I do want to remind Queenslanders, if you get a positive rapid antigen test at home, to register. There is some early information we're hearing that people are presenting at emergency departments saying that they've tested positive, but saying they hadn't registered that positive result. So we really do encourage people. I know that they're registering with the Commonwealth as far as any subsidies available, but it's still important to go onto the Queensland website and to register their positive test. In relation to the deaths today, again, our condolences to the families of those who have passed in relation to COVID. But I do want to point out that of those deaths so far, only 8.2% of our population over the age of 16 are unvaccinated. So they only make up just over 8% of our population currently, but they make up 21% of our people who have died with COVID. That's the unvaccinated people. And of course, the boosters, of the 111 deaths, we've only seen 5 people who have had their boosters. So it shows the benefit of vaccinations, and I strongly encourage people to come forward and get vaccinated. And I know the Deputy Commissioner's here to talk about vaccinations and our clinics. There's many, many clinics available, and of course pharmacies and GPs I do want to specifically mention the boosters that are available from the 3-month mark from today. Also our 12 to 15-year-olds. I'm concerned that of our 12 to 15-year-olds, only 74.65% have had one dose and 66.61% double dose. Now, these teenagers will be going back to school face-to-face in a couple of weeks, and we're really concerned that those numbers are lower than what our adult vaccination rates are. They should be at the same rate now. The opportunity is there. It's great to see of our 5 to 11-year-olds that 1 in 4 are already vaccinated, but I'd love to see parents and guardians and carers coming forward with their children of all ages who are eligible and getting them vaccinated as quickly as possible before the start of the school year. Thank you.
Good morning. As both the Premier and the Minister have indicated, today is booster day. So anyone where it's been now 3 months since your second dose is eligible to come forward and get their booster today. What that means is there's 600,000 more people in Queensland today, right now, who are eligible to get their booster. So we know there's 1.2 million approximately people in Queensland right now who can come forward today and get their booster at any of our clinics. They can book into their primary care, their GPs or our community pharmacists. All of our clinics, all of our state clinics around the state will accept walk-ins for boosters, as well as first doses and second doses. So last week alone, we did 243,000 boosters across Queensland, across the system. So we definitely have capacity for you to come in. So please, if you're eligible today, all you need to do is walk into one of our state clinics and we will provide that booster shot. Of course, we will also provide first doses and second doses at all of our state clinics. And if you want the convenience, you can book into our pharmacies and our GPs. Now, with respect to our 5 to 11-year-olds, most of our clinics around the state, definitely all of our big clinics, are definitely accepting walk-ins for our 5 to 11-year-olds. The Brisbane Convention and Exhibition Centre, as we see here, is a great setup. There's free parking underneath while you get your booster. We've got resources for 5 to 11-year-old children when they come in. We accept walk-ins. Australia Day, make a day of it. Come into the city, get your booster, get your children vaccinated and make a day of it in the city. And that's the same across all of our big clinics. Cairns Convention Centre, Broadbeach Clinic, Coomera Clinic, Logan Entertainment Centre, Rockhampton, Townsville, Mackay, Mount Isa. All those clinics are accepting walk-ins for our 5 to 11-year-olds. And we particularly want to focus on the next 2 weeks before those kids go back to school. We have capacity, we have staff, we have vaccines. So I ask all parents, please, make it as one of your go back to school to-do list to come out and get your kids vaccinated. From our 5 to 11s and 12 to 16s, we've also increased our communication through our school channels, through our parents and citizens clubs, through the school network, so we can direct message the parents about the availability of the vaccines. So my last message is, if you currently have an appointment for your 5 to 11-year-old or an appointment for your booster, and you can't get that appointment for a number of weeks, please go online and have a look if you want a booking. Our primary care, our pharmacists are releasing bookings every day. But don't forget you can walk into one of our clinics. And Australia Day, I will say our clinics are open on Australia Day. There are only a number of small clinics out in the western area of Queensland that won't be operating on Australia Day, and that's primarily because they do their vaccinations through outreach and pop-ups. So, we've scheduled those outreach and pop-up clinics around that public holiday, but all of our big clinics, right across, including the one we're at today, they're open on Australia Day, so please come in and get vaccinated. Thank you.
Premier, the boss of the CCC and the IAA that reviews into their performance, the Integrity Commissioner has quit. What does that say about the atmosphere of integrity within your government?
Nothing, because my understanding is that the Integrity Commissioner has taken another job. I mean, people move jobs from time to time. Even in the media, people move and take different jobs. So that's completely up to the individual. My understanding is she doesn't leave until July. And in relation to the CCC report, to the report into the CCC, I made it very clear that Cabinet would be considering this matter before Parliament resumes. And in fact, the government response is due, my understanding, is around March.
The Integrity Commissioner had asked the Department of Premier and Cabinet to do a call for approval to do a forensic examination on her laptop after her initial request to the Public Service Commission was declined. Are you aware that she asked the Department of Premier and Cabinet for this?
I'll look into that, Lydia. I don't have the exact details in front of me.
Do you think it should have been approved?
Look, my understanding is some of these matters were before the CCC, so I'm not going to get into the details now publicly.
In her annual report, she, Dr. Stepanov mentioned that there crippling staffing issues were affecting her ability and her office's ability to investigate and do their job and provide advice. Do you think that's appropriate?
What I make very clear is that people change jobs all the time, and she has indicated that she has taken on another role in Queensland.
Do you think it's
Sorry? People change jobs all the time, Claire. I don't think it's a problem at all. We'll advertise and have a new integrity commissioner, honestly.
it's appropriate though that office isn't staffed properly?
The office is staffed appropriately, and my understanding is that I think extra staff were provided to that office.
The annual report
Oh.
made clear though that the staffing shortages were crippling her ability to do her job, so she's effectively saying she can't monitor the integrity.
Look, I'll look into that, but I don't think that's the case at all.
Premier, when is Cabinet going to make a decision on Alan McSporran and the CCC? I mean, you've got two.
Within the next 2 weeks, Josh.
Will it be discussed at this Cabinet meeting?
No, I made it very clear the other day that the focus is on the peak of this pandemic that Queenslanders are entering into over the next 2 weeks, so that will be our priority. There'll be extensive discussions about that today, hospital capacities, when the different regions are going to be peaking, ability of staff, the furloughing of staff. All of those issues need to discuss today. And as I said, within the next couple of weeks, definitely before Parliament goes back, we will be looking at that in depth. And I want Cabinet to really take its time and definitely consider that. It's a very detailed report. I've finished that report, and it's a very serious report.
But what do you think voters think with the CCC under a cloud and now the Integrity Commission walking off?
I don't think they would think anything of it. People change jobs all the time. I do not have a problem with the Integrity Commissioner saying she's taken on another role.
In the middle of an investigation?
No, that's not true. That's not correct. Okay. Anything else?
After Cabinet that today you released a plan on schools, so we can expect to see that plan today?
Cabinet will be considering the plan on schools. Schools go back in 2 weeks' time. The priority is to get kids vaccinated, get those children vaccinated, and we'll be releasing our plan this week.
Do you think students should get rapid antigen tests before they go to class?
There is no advice, there is no health advice saying that that needs to happen, but Cabinet will be looking at all of those issues.
Premier, are you relieved that, as the CHO said, the pressure on the hospital system wasn't as expected?
Oh, absolutely. At this stage, I'm very relieved because we were expecting thousands upon thousands of people in our hospitals. It is a huge relief, but I don't want to get ahead of it at the moment because I'm very cautiously optimistic, but I want to see what happens in the next couple of weeks. But it is a relief at this stage, yes. And it's a huge credit to Queenslanders, honestly. You know, it's the fact that we've been vaccinated. Every Queenslander's had the opportunity to get vaccinated. Now we're getting the boosters. We've got our children that have the opportunity to get vaccinated as well. Don't forget, we've got this window of opportunity now of 2 weeks to get our children vaccinated before schools go back, and we're very lucky to have that.
Premier, will you name yourself as a member of the Brisbane Olympic Games Organising Committee?
I haven't turned my attention to that. There are more pressing issues at the moment, but the Olympics is a great opportunity for our state. I think everyone knows that. It'll be, it will open Brisbane and Queensland up to the world, and there's a lot of exciting things that are happening on that front, and of course all of my team are excited about the possibilities and the opportunities that it presents to this state.
When do you expect to make an announcement on that?
Sorry?
When do you expect to make an announcement on your selections?
Be this month.
On Friday, though, you said the schools plan would be released today, so
Sorry?
what changed? On Friday, you said the schools plan would be released today, so what has changed?
Yeah, we've got to discuss that at Cabinet, look at the advice and everything. So it'll be announced this week. We've got a good 2 weeks until school goes back. In New South Wales and Victoria, their plans were released because they're actually going back. So there was urgency. But I want to make sure we get the plan right for Queenslanders. And as I said, there is no health advice at the moment that says that children need to be tested from either the Chief Health Officer or AHPPC. I want to consider that in detail and make sure we get it right for the parents and students of this state.
Okay. Dr. Gerard, sorry, can I ask you a quick question?
Yeah, just a quick question then. We've got Cabinet.
You've talked about the peak coming, but then a significant flatline. So, what can Queenslanders expect once we do reach that peak in terms of community transmission and hospitalisations?
Well, I think what we believe the peak will probably occur. The average peak will occur in Queensland sometime next week, particularly in metropolitan Brisbane. But it won't be even across the state. So different regions will have their peaks at different times. So I'm really talking mostly about southeast Queensland. Cairns seems to be on the same trajectory, and different regions will have different peaks at different times. There will be pressure. I really must emphasise there's likely to be pressure on the hospitals in metropolitan Brisbane this coming week, as there has been, particularly in Gold Coast University Hospital and Robina Hospital in the last week. So there will be pressure there, but they managed it and they're fine. So I think we can expect the same thing coming into this week, and then it'll probably taper off slowly. It appears that the peak is not as steep as they've seen in other states, in New South Wales or Victoria. We think that's because of our high vaccination rates, the fact that the virus was introduced. We didn't already have the virus spreading in Queensland in December, so we had an opportunity to get everyone vaccinated before the virus was in Queensland, which I think is a huge success for Queensland. And also the behaviour of Queenslanders. I think Queenslanders' behaviour has slowed this peak somewhat because they're heeding the warning. So we're not getting a very tall peak. It would appear. But the next 7 days will be particularly important here in metropolitan Brisbane.
Just on vaccinating the primary school age children, it's 27% today. What sort of percentage do you want to see before school returns?
Well, I'd like to see as many as possible. There's plenty of opportunity for children to get vaccinated over the next 2 weeks.
Will it still be safe for them to go to school if there's only like a third of kids vaccinated?
It will be safe. I mean, the virus will spread in schools when the schools open. That will happen, and most children will be fine. Okay, so I mean, the vast majority of children who acquire this virus, they have a mild illness.
Consistent with that message, you've always been not understating or dismissive of the threat, but tried to be realistic. You've said the vast majority of people's symptoms will be mild or non-existent. To that extent, I mean, obviously there's a fine line between vigilance, which you're encouraging, and paranoia. At a time in other parts of the country, fear-mongering has emerged as an issue. What do you think the long-term mental health impacts of the saturation publicity, the repeated warnings of various intensity will have on young people in particular?
Well, I think it has been very hard to get the tone right. I struggle with it. I think everyone has struggled with this. And on that issue of the children, I mean, the vast majority of children will be fine, but because we know there will be very large numbers of cases in children, like many cases, it will happen, there will be a small number that will get a significant complication from this virus just because of the sheer numbers involved. That's almost inevitable. So there are rare complications of this virus in children, but they're rare. They're rare. I mean, I'm not sure how frightened young people are actually of this virus. My impression is that most young people are not afraid of this virus, which is probably legitimate, although we want them to get vaccinated because there are rare complications.
For people that are double vaccinated but have now got COVID before receiving their booster, what time period should they wait before getting the booster if they've had COVID?
Again, there's no definite guidance on this. It is not unreasonable to wait a couple of months before you get it. The Commonwealth's guidelines say that you can get it at any time when you're due. There's no specific recommendation to delay once you've recovered, once your symptoms have recovered. It is not unreasonable to wait another couple of months for the booster, but there's no specific recommendation to delay.
Really got to go.
Okay. Thank you.